Hi, my name is Whiteside. I'm originally from Lexington, South Carolina. I was diagnosed with precancerous cervical cancer in my 20s, and I started the National Cervical Cancer Coalition South Carolina chapter in January of 2011. And I basically started that chapter to help raise awareness on cervical cancer and HPV-related diseases. And we also aim to inform the community about HPV vaccinations and how prevention and early detection can prevent cervical cancer. So my story starts off when I was in my mid-20s, and I always went to my annual Well Woman exam. And then I was actually given the news that I was having abnormal pap tests, and I really didn't think anything else of it. I continued to go to my annual exams, and basically my doctor told me that the HPV would go away on its own. Unfortunately for me, several years later, it was still there, and it was high-grade dysplasia. So I had a LEAP procedure done, and then 6 months later I had to have a cone biopsy taken of my cervix. And for that, it was probably the longest week of my life waiting for that biopsy to come back. And luckily for me, the biopsy came back with clear margins, and ever since then I've had a normal pap smear. I was so grateful when the cone biopsy came back with clear margins. I remember when the nurse called me to give me the good news, I was literally crying before she got off the phone, really tears of joy. So I think for me, I want other women to know that there's a lot more women that have my type of story that you're maybe not hearing about, because HPV is has a stigma centered around it, and that's what we're really trying to aim to break the stigma of HPV related diseases. While you might hear other stories of women that are diagnosed with cervical cancer, there's a lot more women that are diagnosed with precancerous lesions like myself, and that's something that can be prevented. And for women, a lot of things go through your mind while you're waiting for a biopsy. You can think, oh gosh, do I have cancer? Am I going to be able to have children? What are my friends and family going to think of me? And that can bring about a lot of anxiety. So I think when you're waiting for the biopsy and for those tests, a lot of doctors and family members and friends should really realize that there is anxiety associated with that. And for a lot of women, it takes a lot to wait for those tests to come back. I would really want to let other women know that they should continue with their annual Well Woman exam. They should have the HPV co-test as advised by their provider, and they should also, if they're in the certain age limits, they should receive the HPV vaccination. So that's not only for women but for men, boys and girls. And I think you shouldn't be afraid to ask questions, because you know your body more than anyone. You can determine what's best for you and follow the guidance of your doctors, but also don't be afraid to ask questions. I like to share my story with others because I want to help spread awareness on HPV-related diseases, the HPV vaccination, and how cervical cancer can be prevented by early detection. Since it is a disease that is sexually transmitted infection, there is a lot of stigma attached to that, and what you can do to help break that stigma down is to share your story with others. And so that's what I've been trying to do in our community in South Carolina. So the sooner we're able to end the HPV stigma, the sooner we'll be able to eradicate cervical cancer.